Good evening, everybody, Mr. Chairman and committee members. Thank you very much for your time and for allowing this to take place. I'm here today to speak in favor of House Bill 1294. My name is Stacy Sanchez. I'm a leader with Hoosier Action. I'm a bachelor's prepared registered nurse, international board certified lactation consultant, a NHTSA certified car seat technician, and I'm on the board for the Indiana Breastfeeding Coalition. I have dedicated my career to the safety of new families. I work as an OB nurse in Lake County, Indiana, on the border of Illinois, and I take care of too many who are indigent, underserved, and underinsured. I've personally not attended the births of incarcerated women, but I have attended hundreds of births, and I've had 4 of my own. And I can tell you, as was said earlier, there's like zero reason to restrain a woman like that during labor. The labor and birth process is well documented to be very emotional and can result in birth PTSD even in the best of times. But in the worst of times, we're doing severe emotional damage to these patients that goes beyond just one day in our lives, as we heard our other speakers say. This can cause long-term mental health issues to the parent and can interfere with bonding, which can negatively impact how well the baby's going to thrive. I've witnessed 2 events in this life that are as similar as they are different, and there's nothing else like it, and that is giving birth and dying. Shackling people in this extremely vulnerable state is cruel. Despite their crimes, they're still a person, and when you're stripping away their dignity and they're in a compromised state, they already feel devalued and defeated, and we're taking away their confidence in themselves right when they need it the most because we need them to step up and be a parent. Lake County, Indiana has an infant maternal mortality rate second to Marion County. I see a lot of death. Our moms and babies are dying at an unprecedented rate, and restraining moms in the peripartum period further compounds this issue. Parents and children who do not bond properly have higher rates of child abuse. We need to give newborn Hoosiers the best start possible, and this includes an emotionally safe environment that supports and educates our moms as they grow their babies. This is an issue of equality and justice. We know that our criminal justice system disproportionately affects low-income women and women of color, and they're often locked up for low-level nonviolent offenses. We need to move towards a more human-centered public health approach for the challenges facing our criminal justice system. This bill is a step in that right direction. It promotes human dignity. It promotes best practice in medicine. It promotes best practices for mental health in the postpartum period. It provides education for our DOC staff. It provides education for our incarcerated women so that when they know better, they do better. And it requires the reporting of any use of these restraints on pregnant inmates. All Hoosier moms deserve dignity in childbirth. Forcing incarcerated women to give birth in chains doesn't make any of us safer. All it does is make childbirth more dangerous for the mom and the baby. We need to see an end to the endorsement of this practice in all DOC's facilities. And when admitted as a patient, when the mother is admitted as a patient, why does her medical team not take over? Instead of using our limited resources to endorse such punishment and restraint, it would be better spent ensuring that these people receive the support they need to properly recover and re-enter society. All Hoosier moms deserve dignity in childbirth, and newborn Hoosiers deserve the best possible start to life. No one should have to be born to someone in chains. Thank you.
Thank you very much.
Bill passes, 12 yeas, 0 nays.
Okay, thank you. Thank you very much.